Now we talk about the anticholinergic drugs, and since these are antagonists, we look at this table and we see the cholinergic effects, right? And we have to reverse that, knowing that we are dealing with antagonists in this recording. Now, we remember that there are two types of mechanisms. The one which goes straight to the receptor, so these are the direct anticholinergics. And there is only just one which does the job indirectly, which is to regenerate acetylcholinesterase. So since majority are located here, let's first subdivide them. And we divide them based on their origins. We can call the ones that are natural, coming from plants, as belladonna alkaloids, in homage to Atropa belladonna, which is the scientific name of one of the most popular plants, where we get them. And the synthetics, meaning all of the structure of the drug comes from the lab. None of it has been extracted from nature. And these are examples of such anticholinergics, wherein those at the top until benztropine would comprise those coming from plants, at least partially, and the rest here are the pure synthetics. And now let's go to the uses of these, because again, they are pretty much varied. First, atropine and hyoscyamine. A little bit of clarification in terms of their chemistry. And I think I need to mention this because people usually get confused with this, even those who have already encountered a pharmacology course, a formal one, and are already just reviewing now. These sound different, but actually they are the same. It's just that hyoscyamine, that word refers to a single isomer, like the dextro or the levorotatory form, but atropine refers to the mixture of those different hyoscyamines. In other words, these are structurally the same. And therefore, when we mention atropine, it's just the different hyoscyamines blended together. Ironically, the other one, which we call hyoscine, and many people mistake this as the other name of this one, these two are not even the same. You know what's the same as hyoscine? The word scopolamine. So that's one thing we need to clarify first, because people take for granted that all of them come from similar plants like datura, atropa, but these are the ones that are the same, and these two words are the same thing. Now, for atropine, I can think of two uses. One of them is for excessive bradycardia. And that is because bradycardia, or slow heart rate, is a typical effect of activating empty receptors. And by reversing that, you can deal with it. Another use of atropine is as an antidote for cholinergic excess. And if you watched my previous video about cholinergic agonists, the mnemonic dumbbells should be something you would at least remember until now. Atropine is expected to be a natural enemy for that, because this is cholinergic activity, this is anticholinergic activity. Other than that, atropine's uses back then were already removed because there are other better and safer medications. Okay. Next, we have, hyoscyamine is the same as atropine. So we go to the next one, scopolamine, aka hyoscine. So these two, this has two uses. One of them is quite outdated already, and that is as an antiemetic. Remember that one of the effects of too much cholinergic action is emesis. You feel like you want to throw up, and we can antagonize that. Specifically back then, we give scopolamine patches, and these patches were said to be like just as large as a fingernail, and then you can peel it off, put it at the back of your ear. But nowadays, we don't really need that because we already have tablets that do the same thing. So you don't need to do the labor of peeling and putting a patch at the back of your ear. Additionally, the problem with scopolamine before is that it also blocks some of the muscarinic receptors that have to do with wakefulness. So essentially, it makes you drowsy or sleepy. And some people who want to get this effect do not necessarily want to go to sleep. They might even be working or studying, right? One thing that scopolamine in the name of hyoscine is used for in the modern day, very popular, is an antispasmodic. Particularly in the N-butyl bromide form. So if I'm going to write the entire name, it's hyoscine and butyl bromide. In fact, it has a very popular brand, but I'm not going to mention it here. But well, I think we can agree that menstrual cramps can really be debilitating, especially on those special days, right? And since those cramps are in part contributed for by excessive gut motility, we can contradict that, which is why hyoscine works for this case. So that's it for the uses of scopolamine. Next, we have ipratropium and tiotropium, which from the name, you can assume that it is related and is a derivative of atropine. These are actually two drugs that have the same route, inhalational, and you can probably guess what it is used for. Of course, for asthma or COPD. This is because, well, look at it. One of the effects of cholinergic activation is bronchoconstriction, which is a bad thing for people with asthma, right? Then you can contradict that and you get bronchodilation, makes it easier for these guys to breathe. Then we have another derivative of atropine, which is benztropine. It's a semi-synthetic, therefore, and it has a different use alongside the two synthetic drugs by pyridine trihexyphenidyl plus others, but these are three of the more mentioned ones for the capability to reduce tremors in Parkinsonism. Unfortunately, Parkinsonism or Parkinson's disease is not purely attributed to the ANS. In fact, it has something more to do with the central nervous system. So we will deal with this on a separate video, but the tremors part is ANS related, they say. So ANS drugs like these work. Dicycloverine is another synthetic anticholinergic, which is used a lot for diarrhea because just like menstrual cramps, just on other muscles, it is also excessive gut action that causes diarrhea. So you can contradict that as well. Then you have oxybutynin and tolterodine, which are two of the known anticholinergics that can deal with urinary incontinence. So meaning you cannot contain it. For example, you want to urinate, but you cannot find the toilet yet. You can hold it, right? But some people, due to various reasons, cannot. And in some of those people, it is traced that it's muscarinic activity. Since it causes urination, by blocking it using these drugs, then you can probably hold it better. Then finally, for the examples here, we have tropicamide and cyclopentolate, which are also, one of them is a derivative of atropine also, but both are used as eye drops for eye exams. Why? Because one of the effects, it's not written here, but it's written above. Contradicting this one, you get mydriasis. And for ophthalmologic exam, it is very helpful for the one giving you the exam to dilate your pupils. Now, I also want to mention, since this was already part of the conversation, that atropine was used for that exact purpose back then. Little trivia. Do you know that belladonna translates to beautiful lady? And they say that the origins of that is that centuries ago, women would try to put an extract of belladonna, which of course has this atropine, on their eyes. It will cause this. They look pretty. However, the problem with atropine is that its effect lasts for several hours. So we cannot use this for eye exams because eye exams don't really last for several hours. It's much shorter. And since tropicamide and cyclopentolate are shorter acting compared to this, these are the more appropriate drugs to do this. Before we forget, these are not the only drugs in this list because, again, I did mention we have a single representative here, which is pralidoxime or 2-PAM. And really, the purpose of this is actually something we already saw a while ago, which is also being an antidote for cholinergic excess. That's right. We have two of these in this single recording. One of them is the direct anticholinergic atropine. If this does not work or needs extra help, then we have the indirect anticholinergic pralidoxime. So these two are well recognized for that same purpose. Now, finally, of course, we know the dose makes the poison. So what happens if you mistakenly give too much of these anticholinergics? We have this quote, which many people fondly call the Alice in Wonderland effects. So it's like you're being in a sort of fantasy world because the feeling is really different. One, you are said to be blind as a bat, blind because one of the side effects is loss of accommodation, which is a more technical term for basically saying you cannot focus your eyes, Like something's farther, something's closer, everything is blurry. A more technical term for this in the context of what the anticholinergics do is cycloplegia. And that's the price to pay for those ladies who wanted to look pretty. Yeah, you have dilated pupils. That's your beauty standard of the 1700s, 1800s. But you should endure the blurring of your vision. Dry as a bone, that's because you have reduced secretions. And by secretions, sweat, saliva, and aqueous humor. And because you don't have much saliva, it feels like your mouth is really dry. And also your eyes, and both your mouth and eyes can feel irritated because these secretions are meant to, one of their purposes to lubricate them. So for example, some people start scratching their eyes, they feel like there's sand in it because of this. Red as a beet, because one of the, I haven't mentioned it as much here, one of the effects of anticholinergic activation is, or anticholinergic drugs is flushing. So your blood vessels are dilated, so more blood will flow, and the color of it will show for other people, which is red. Okay? Not only will that make a person look more red, since the blood flowing will cause heat, the body temperature of that person will rise, and some people will really feel very warm, hot as a hair. That's not the only reason for this hotness. Also, remember that we don't sweat anymore. Normally, especially if it's a warmer climate, sweating is a way to get rid of heat. So if you don't sweat, you keep all that heat inside. Sometimes some people go as far as having fevers. Like there are some children documented way back, they are called to have a atropine fever because it coincided with them taking anticholinergics. Some of them even reached a convulsive state, so it's definitely a cause of concern. And finally, under the Alice in Wonderland effects, we have a mad as a hatter, because sometimes the effects of anticholinergic activity on some muscarinic receptors in the brain result in basically a person being observed to get confused. So there's a lot going on here. Definitely a warning sign not to overdose on any of these. And this covers the examples, uses, and toxicities of our anticholinergic drugs.